Bella Salon and Day Spa, located at 41 West Main Street in Northeast Pennsylvania, proudly supports Chautauqua Sunrise and its volunteers. More information at bellasalonanddayspa.net. Westfield Memorial Hospital provides high-quality health care to residents of Western New York, offering patients the most sophisticated medical advancements while keeping the ease and familiarity of a community hospital. Support for Chautauqua Sunrise has been provided by WRFA 107.9 FM, Jamestown's public radio station, streaming online 24/7 at WRFALP.com. Low power to the people. Funding is provided by a grant from New York State Senator Catherine M. Young, representing Western New York's 57th District with a local office in Olean. Chautauqua Sunrise is made possible by a grant from Fredonia Place, a continuing care retirement community providing dignity in a modern luxury environment. Meter's Restaurant, a family tradition for over 50 years in downtown Ripley, is a proud supporter of Chautauqua Sunrise. Meter's provides all-day dining, banquet services, and custom catering, specializing in pie. From the Access Channel 5 studios in Mayville, it's Chautauqua Sunrise. Chautauqua Sunrise is hosted by Doc Hamels and supported by the award-winning volunteers at Access Channel 5. Continuing the traditions of Senior Report, we are here to share local news, colorful interviews, and events of interest to everyone. Chautauqua Sunrise is broadcast live Saturday mornings each week, countywide, from 9 to 10 a.m. Join us by calling in live, emailing us, or checking out our social media. And now, from the Channel 5 studios, it's Chautauqua Sunrise.
Well, good morning, everyone. I'm Doc Hamels, and welcome to Chautauqua Sunrise. I hope you're having a great weekend, and if you're not getting outside. It's awesome out there. You know, I was thinking the other day, we had all that rain and cool weather, and then it was summer. Just like that, overnight. I've been through this so many times over the years, and you would think you would get used to the weather patterns in Western New York and in northern Pennsylvania. And every year, it's just like a Christmas present. You just never know what's going to show up. So I hope you're enjoying the warmer weather and getting outdoors and doing whatever you do, whether you're down at the lake or out walking or biking and cutting grass, whatever. So anyways, I want to say good morning to all of our friends on WLRFA 107.9, low power to the people in Jamestown, who are listening to us on Tuesdays at 1 o'clock. Good afternoon, and thanks for joining us. The show we have in store for you, I think you're going to find very fascinating. I know I've been holding back and talking with my guests ahead of time because I didn't want to find out all the information ahead, because to me, I don't know anything about the topic we're going to be talking about, so stay tuned. How's that for keeping you in suspense? All right. One of the things that I always like to talk about this time of year, now that the weather's nice, and I don't want to get schmaltzy on you about this, but use the sunscreen, okay? When I go biking now, I notice when I get out there in the full frontal sun coming at me, that by the time I get back, my skin's getting pretty tender, and we forget about that when we're cutting grass and so forth. And just the people I've known over the years that have contracted or developed skin cancer and so forth, please, it's real easy to do, and take good care of yourself. Okay, moving along, I want to remind all your friends that you may be watching this right now, but they may not know where we are, because we moved to 1301, okay? My understanding is that all the access channels in, I guess, New York State have been moved in their local areas to channel 1301, so please pass the word so that they can find us. And of course, if they can't, we're always on YouTube and Facebook, and we post every single week. So hopefully you can join us there. Okay, I want to remind you that this is live right now, Saturday morning at 9 o'clock. And if you have a comment, a question, something you want to share with us, I have a question for myself or my guest, give us a call at 753-5225, and don't be shy. You can Twitter us, email us, you can whatever, get a hold of us. And if you don't want to ask the question yourself, call in. They'll take the question. They transfer it to me through my earpiece here, and we'll ask the question for you. So don't be shy, because today's really an important show as always. Okay. Also, I want to remind you that there's signs all over the place for the art trail. And I think I'm going to mention this again in a little bit, but we had the folks here last week from the art trail, and that's going on this weekend. And I encourage you to check out all the wonderful art that's being produced here in Chautauqua County in the region. Okay, also want to remind you that I just got the bulletin, the booklet for this year's 4th of July parade. And Rick Mascaro and I are going to be hosting that. He'll be co-hosting it with me, and we're going to be announcing that, and that's always fun. That's about an hour and a half, 2 hour show, and that'll be live right down the road as all those cars and horses and kids and music and fire trucks go whizzing by, and we look forward to that every year. Okay, I have a few things. Oh, I wanted to tell you a little story. I forgot. That's right at the top of my little list here. Okay, every once in a while we got these weird things that happen in my house, and they usually involve animals. So I was getting ready for the show today, and I hear this weird noise, and I look outside. Well, I like to grow things, and I have an orange tree, and it has little oranges on it. And if you ever tried to eat those little oranges, they are the worst thing in the world. They are acidic, horrible. So I'm not interested in eating the oranges, but I thought I'll put them outside for a change, because I've never done it before, and see if they would grow bigger oranges or whatever. So I hear this noise, and I look, and there's a chipmunk climbing up my orange tree. The orange tree is only like 2 feet tall, and he grabs this orange, and the orange is about the size of his head. I don't know how he got it in his mouth, and he's pulling on that thing, he drops it, and then the next thing I know, he drops down to the table, he grabs the orange, and he's looking around, and then off he went. But it was just hilarious. I've never seen any animal eat an orange before like that. So. And we had the raccoons trying to attack the feeders again and making a mess. I'm still waiting for my local bear to show up, but we'll see. Okay, so anyways, wildlife is out there and enjoying the good weather as well. Got a bunch of announcements here, so let's get started, Jeff, and we'll start with slide 15. My friends down in Jamestown at the Infinity Performing Arts Center, they want to let you know that if you're a musician or you're part of a group, that they want you to mark your calendar and to register for this year's annual local music showcase. And this is the 15th year, and if you're interested in playing, I've played this like 6 or 7 years in a row. It's a big fundraiser. The whole night is music from 6 p.m. to 2 o'clock in the morning. Just give them a call over at Infinity Performing Arts at 664-0991, or you can go to the website. Okay, you can look them up, and it's easy to find it. It's just infinityperformingarts.org. Okay, today, right now, as we speak in Westfield, okay, it's the 2018 season for the Westfield Farmer and Artisans Market, and it started just about 10 minutes ago. And later today, you're going to hear from Martha Bills, George Borello, Mike Vandeveld, John Hemmer, and Andrew Goodell. They're all going to be speaking at the gazebo, just welcoming everybody to the Farmers Market, Artisans Market, they call it Farmers and Artisans Market, at 1 o'clock, and welcoming you and talk a little bit about the project there. And it's going to run starting today right through September 29th, and it's every Saturday in Moore Park from 9 a.m. to 2 p.m. If you're not familiar with them, they have farmers products, food vendors, artisans, fresh eggs, pork, beef, chicken, honey, maple syrup, jams and jellies. They're going to have some live music. I'll be playing there in July. Handcrafted products from the Amish for baskets, jewelry, beach glass, paintings. I mean, it's just like it's a big affair. Rocks and stones and home decor and all kinds of good stuff. And in case you're interested in showing up there and selling your wares, give Nancy Scriven a call at 269-9726. And once again, today starts the Westfield Farmers Market in Moore Park. Okay, moving right along. Number 16, art exhibit. The Resource Center over in Jamestown has an art exhibit at Writer's Cup Coffee Shop at 28 Chautauqua Avenue, and that's going to run from today forward through June 2nd. So this is going to be your last chance to check out the great artwork that the folks over there at the Resource Center have put together for you, and I believe you can buy the artwork as well. So check it out. The regular hours, Monday through Saturday, are 7 a.m. to 5:30 p.m., and then Sunday, 9 a.m. to 2 p.m., and that's at the Writer's Cup Coffee Shop in Lakewood. Okay, this is from the Chamber of Commerce, real brief. There's a county executive breakfast, June 1, and the Chamber is providing an opportunity for its members to meet directly with County Executive George Borrello and ask questions. It's going to be held 8:30 Friday, June 1 at the Moonbrook Country Club out there on North Main Street Extension in Jamestown. Cost is $18, and if you want more information, give them a call 366-6200 or 484-1101. Okay, another new event. I don't remember this until this year. On June 2nd, there's going to be the Shake, Rumble, and Roll. I had this all backwards a couple of weeks ago. It's a poker run which benefits people with traumatic brain injury, post-traumatic stress disorder. This is a motorcycle poker run which will be held, I just said that, June 2nd. They kind of repeat themselves. With proceeds benefiting services for people with traumatic brain. Just said that too. I just read this stuff. I don't write it. This event is called Shake, Rumble, and Roll. I'm doing the Bill Haley thing. And it's being coordinated by Filling the Gap Incorporated. Participants will meet at the Resource Center's administrative offices, 200 Dunham Avenue in Celeron, between 8 and 10 a.m. to check in and draw a playing card. Following a blessing of the bikes, participants will head off on a route that takes them to 7 locations: Frewsburg Legion, Ellicott Brewing Company in Bemis Point, Whiskey Hill Saloon in Casadega, Sunset Bay Beach Club in Irving, the Resource Center's facility on Lakeshore Drive in Dunkirk, the Westfield Legion, and the Lakeview Hotel in Mayville. Okay, writers will draw 1 card at each location. After arriving at the Lakeview Hotel, participants will submit a 5-card poker hand and 3-card poker hand. The person with the best 5-card will win $500, while the person with the best 3-card hand will win $300. Okay, and if you're interested in registering, give them a call at 661-1477 and ask for Vicky. Okay, that's on June 2nd. Okay, moving along, Fredonia Chamber Attic and Cellar Days, June 1 through the 3rd. The Fredonia Community Chamber of Commerce will hold its annual Attic and Cellar Days the first weekend in June. Sellers can register at Pucci's Carpet 1 at 112 Main Street, Fredonia, or at Sir Prince-a-Lot's, 1 Park Place in Fredonia during normal business hours. The cost is $5 to register your sale and be included on the sale map. Each additional line, up to 5 words per line, is an additional $1 per line. If you have questions, give Heidi Seddon a call at 467-4321. And then the maps will be available at the information booth in Barker Commons. So that's coming up next weekend, the Fredonia Attic and Cellar Days. Okay, then we have free June parenting classes being offered through the acclaimed Active Parenting Program directly to you. This program will give you skills to achieve a fuller, more satisfying family life and help your children achieve greater happiness and success. Let's see, this workshop will show you effective ways to use nonviolent discipline, open lines of communication with your children, teach responsibility, courage, and other types of traits, encourage school success in 7 steps, and all kinds of other things that we would associate with good parenting. There's 6 2-hour sessions. They start, June 6th and run through July 18th. They will be from 12 p.m. to 2 p.m., held at the Mental Health Association at 31 Water Street at the Gateway Center in Jamestown. It's free of charge, but you got to register. So give Kathleen Colby a call at CASIC at 664-3608. All right, make sure I'm staying in the right order here. Okay, now just briefly, there's a Laugh Out Loud, a sneak peek comedy extravaganza. It's going to be held on June 7th. Let's see here. Reserve your spot now to attend this once-in-a-lifetime event. The Chautauqua County Jamestown Community Chambers of Commerce are excited to be co-hosting a one-night-only event in partnership with the County Visitors Bureau and the National Comedy Center. Laugh Out Loud is a sneak peek comedy extravaganza, and it'll be held June 7th at the brand-new attraction at 211 West 2nd Street in Jamestown. If you're interested in going, give them a call at 484-1101 or 366-6200. And tickets are, looks like $35 for, oh, no. Okay, scratch all that. Just give them a call because there's different things here, different options you can have. There's dinners and so forth. And rather than getting involved with all that, give them a call at 484-1101 and they can explain more. Okay, Chautauqua Lake Child Care Center Golf Tournament is going to be held June 9th at the Chautauqua Point Golf Course. And it's $50 per player, 4-person scramble, 18 holes of golf. You get a cart, hot dog lunch at the turn, beverages, plus a raffle ticket, 50-50 ticket, and entry in skins prize. And a chicken dinner follows. Okay, for more information, give them a call at 753-5851. And that's the Child Care Center right down the road at Chautauqua Lake Central School. And let's see. Okay. Chautauqua County Historical Society Gala fundraiser coming up on Saturday, June 9th. There's a picture of the McClurg Mansion. It's going to be held from 6 to 8 at the mansion and museum at Westfield's Elmore Park, located at the corner of routes 3, 94, and 20 in the village. The fundraiser will include tours of the museum, complimentary hors d'oeuvres, and wine tasting, along with musical entertainment by the dynamic folk duo and acoustic rock group Russell and Hamels, also a.k.a. known as Doc and Willie. They've been calling us that lately. Must be because it's easy to remember. Admission for the event is $50 per person. This is a fundraiser. For tickets, give them a call at 326-2977. All right, moving along. Let's see. I talked about that. Just a couple more things. Mark your calendar. The 5th Annual Charity Golf Classic at the United Way of Northern Chautauqua County and Walmart are presenting their 5th Annual Golf Classic on June 15th at the Tri-County Country Club at 540 Route 39 in Forestville. Registration is at 11 a.m., shotgun at 1 p.m. Cost is $110 per person. Ahead of time and before the, oh, that's already passed. It's now, it's now $125 a person. Includes, of course, 18 holes of golf, cart, greens fee, tea gift, lunch, and dinner. And the proceeds benefit the United Way of Northern Chautauqua County and all their 13 community partners and impacts 24 programs. For more information, give them a call at 366-5424. All right. See, what's this all about? Okay, this is a mark your calendar. We'll talk a little bit more about this next week. But let's see. Cassock is having a chicken barbecue, Chevetta's chicken barbecue on June 23rd at the Jamestown Jammer Stadium. And tickets are $10. And if you want to know more information about that particular event, give them a call at 664-3608 or 366-4623. And so it looks like a fundraiser. It can be at the stadium, and it's a chicken barbecue. All right. We'll talk more next time. All right. Addiction Response Ministry ChristCentered Recovery Program. It's going to be the Bishop LaCroix Clark is presenting on June 23rd from 9 a.m. to 3 p.m. at the Pillar of Fire Church in Dunkirk at 221 Lakeshore Drive West, and this is going to be free. It's being presented by the Addiction Response Ministry in Chautauqua Alcohol and Substance Abuse Council, and the intent of the course is to develop facilitators who can effectively teach the Christ-centered recovery class to those affected by substance abuse. Again, give Kathy a call at 664-366-661. Too many 664-3661, and the deadline for registration is June 14th. And then, of course, number 20 is the WLRFA's 2018 Great American Picnic. I love the 80s theme. And it's going to be held on Tuesday, June 26th at 5 p.m. to 9 p.m. at Southern Tier Brewing Company. And that's all I got for now. So mark your calendars for all those events. There's something happening here all the time. We're going to take a break and we'll be right back. I'm about losing my voice here. Okay, welcome back. You're watching Chautauqua Sunrise, and I'm Doc Hamels, and I want to welcome to the show Dr. LaTroy Navaroli, who is in charge of the wound clinic at Westfield Memorial Hospital. Good morning.
Good morning. Thanks for having me.
Absolutely, and this is part of the ongoing desire on my part anyways, is to share with my viewers and listeners some of the medical facilities and opportunities and services that are available here in western and northern Chautauqua County, especially through Westfield Memorial Hospital. LaTroy, this is an area that I would bet if you had 100 people, maybe 2 people might have ever heard of the wound clinic. And I was one of those 2 up till recently, and now I know a little bit more about it. And but before we do that, can you tell us a little bit about yourself and anything you want to share with the viewers?
Well, I've been at the wound clinic for, I think, about 14 years. Mm-hmm. I worked in primary care before that as a family practitioner. I live in Warren, Pennsylvania. I have 3 kids, and they're triplets, so that's my claim to fame.
You got triplets?
I do.
How old are they?
They're 16, so I have a
and
lot
you're
going
still
on.
smiling, and they're 16. That's a big hurdle there alone. And all the same gender? Or?
2 boys and a girl.
Mm-hmm.
But they keep me busy.
They do. At 16, everybody's going every which way. We had 4 kids, but separately, different points. Okay, so 14 years. So how did you end up in Westfield if you're in Warren?
You know, when I worked in Warren for primary care, I had taken a new position, and I wasn't really happy there. And I had a patient come in, and she had an abdominal wound. Really nice lady, and I didn't know how to help her. She wasn't healing for me. So there was a wound clinic at the Warren General Hospital. I thought, well, I'll make her an appointment there. I called the wound clinic to make her an appointment, and the physician who ran the wound clinic happened to answer the phone. And I knew him from before. He had been a friend of someone I worked with previously, and I made her an appointment, and he said, well, what are you doing? I said, I'm working in primary care. And he said, why don't you come work for me? And I said, oh, don't tempt me. I was having a particularly bad day. And he said, I'd like to tempt you. So we had dinner, and he talked to me about it, and I really wasn't sure because I love primary care and how many things there were to it. It was so interesting, and I thought that wound care would be one-dimensional. So I asked him if I could spend the day with him. He had a wound clinic in Erie at the time that was affiliated with St. Vincent, and I went and spent the day with him, and it was so fun. And I really still wasn't sure because I thought it was the physician because he was very charismatic, and it was just very fun being with him. But I ended up going with him again, and then finally made a decision to go into wound care. So when I started in wound care, he said, I'll pick you up at 6:30 and just go spend some time with me and learn what we're doing before you do this by yourself. So for about 6 months, he'd pick me up every morning, and I'd go with him to his wound clinic and just observe him and help him. And after about 6 months, he said, okay, I think you need to know whatever you need to know. Go do wound care. So I called Westfield Memorial Hospital, one of the first calls I made, and I said, would you like to have a wound clinic there? And they said, sure. And we set up a meeting, and I opened the wound clinic a month or 2 later.
Who was the director at the time?
I don't remember.
Was it Stu Williams or before him? Mort Flexer? Doesn't matter.
I'm afraid I don't remember.
Okay.
There have been several since then, so it's been a long time. But
so it all started with just a phone call.
just a phone call. My first day I had 3 patients, And now we've expanded, of course, and added recently a second day. And I usually see 25 or 30 patients each day that I'm there, so 40 to 60 patients a week there now.
Okay, so I'm sitting here somewhat overwhelmed just thinking about this. What do you mean by wound? And I told you my little story when I first heard that we had a wound clinic. And I was on the board of directors. I mean, I thought I knew most things. And they said, oh yeah, the wound clinic over there. And I go, what are we talking about, wound clinic? And I'm thinking, you know, somebody comes walking in, and honestly, I said this, like, with an arrow in you, or you get shot, and I was just so naive to the whole thing. So how about define, what do you mean by wound, to start with?
Well, it's an outpatient wound clinic, so the people generally come in from the community. They're living out in their own homes. And about 80% of what I see there are venous stasis ulcers. And that's true of any outpatient wound clinic. They're located usually on the lower leg or foot, and they're related to poor circulation. The rest of the wounds that I see can vary wildly. So I see a fair amount of diabetic ulcers. Typically those are on the bottom of the foot. I see surgical wounds now and again that haven't healed properly, and the surgeon will refer them over. I see some pressure ulcers. There are some area nursing facilities that will transport their patients to my clinic, and I'll take care of their pressure ulcers. So we actually have a bed in our clinic that we can transfer the patients into to look if the wound is on their back or if they're unable to stand up. We have a lift to transfer them into that bed so we can examine them. And sometimes I get some more exotic wounds, which I think are super fun, like wounds related to calciphylaxis or calcinosis cutis.
What? Kelsa.
There are some exotic diseases.
Yeah, well, what is it? You got me. You have my attention.
You want to know what calciphylaxis is? Yeah. That's a wound that is usually seen in a person in renal failure. Okay. So their kidneys have failed, and quite often they're on dialysis.
Okay.
If their levels in their blood become out of whack because of the dialysis and the renal failure, they can deposit calcium in their blood vessels, causing death of some tissue. Mm-hmm. So they'll get little sores that usually they'll start purple, then they'll turn to black, necrotic, or dead tissue. They can be excruciatingly painful.
Time out here. You said you enjoy this kind of work.
I do.
You must have a special gift, because I'm sitting here and going like, 99.9% of the people who are listening right now are going like, that's not for me.
You know what's fun about it?
No. Please tell me.
When you go into medicine or nursing, you go in because you want to heal people.
Yeah.
There's no better way to see that happen than to physically see a wound close and a person carry on with a happy life after that.
It must be like magic.
It is. It is.
I was thinking about that on the way here, and I thought, all right, what in the world am I going to say about this? So I was just thinking, you know, as a kid, you get scrapes and cuts and wounds and things like that, but yet our body regenerates itself.
It's amazing. I don't heal the wounds. I allow the body to heal the wounds. I figure out what's missing and try to give the body what it needs to heal. The body heals itself. But we're really lucky that Westfield Memorial Hospital has been so supportive of the wound center. Last year they were able to make arrangements for me to provide bioengineered skin substitutes, which added a whole new dimension to my practice. So if you have people come in with a diabetic ulcer, which everyone knows they're terribly difficult to heal, we can now put a bioengineered skin substitute on, which is like a skin graft.
All right, say that word again. By who?
Bioengineered.
Bioengineered.
They actually take the cells from a living person. They actually take them from a living person and grow them in big vats. I went and toured the company that creates these and grows these.
This sounds sci-fi. You have my total attention.
It's really fun.
Yeah.
I went up to Boston, and this is where they make them. That's where the plant is,
so,
or whatever it is.
So like,
and they grow them out in big sheets, and I'll call and say, Mrs. Smith needs a skin graft. Can you have it here on May 26th? And they'll cut a piece out, put it in a petri dish,
this is
put
human
it on
tissue.
dry
This is human
ice,
tissue.
human tissue, and send it to me. Yeah.
This is
really
this is like a science fiction movie. It's like Star Trek stuff.
So now you can see how fun it is. It's really fun, because not only do they have those ones, they have some that come frozen, they have some that are made of amniotic tissue. I use products that are made from pig intestine. I mean, it's a big industry trying to create ways to heal wounds that don't want to heal on their own.
So you really have to know the body. Mm-hmm. You have to know what's causing the wound, and then
what's
all
wrong
the
at a
potential.
cellular level. Mm-hmm.
So you have a title. You said you are a DNP. You're the first DNP that I've known. Tell us about what that means.
Well, I have a doctoral degree in nursing, and the Doctor of Nursing Practice is a degree that was designed for people in clinical practice. So you learn more about how to practice medicine clinically. And I got that degree from Robert Morris University about 4 years ago.
Well, good for you. I mean, I know people have got their doctoral degrees, and it's a bear. And what was your dissertation on?
It was actually on heel pressure ulcers, because I was working in wound care at the time, and my boss at the time was on my committee to, the advisory committee, and helped me choose that and helped me design my study.
How many people do what you do in this region? I don't know anybody else.
In this county, I believe I am the only full-service wound clinic.
Wow. And it's at Westfield Memorial Hospital.
It is.
And tell the folks where it is, because it's not in the hospital, really.
Yeah, people sometimes come looking for us and get lost. If you know Westfield Memorial Hospital and you're looking straight at it, you see the two dogs out front, the statues. We're actually in an outbuilding called the Myers Building, and it's to the left of the hospital, and just in front of it has its own dedicated parking lot.
Did you send me a picture of the clinic?
I did, yeah.
Jeff, can you pop up those pictures, and I'll give you a sec. So this is in Westfield and on Route 20, and he's searching for the pictures for you here in a second. I have so many questions. See all this? I've already got questions already generated here. I can't wait. Okay, so
that's me and my staff in front of the building. You can see the two dogs off to the right in the picture.
Yeah, there you are.
And right dead center is the receptionist, Wendy. To the left is the nurse, Sue Heft. She's been there with me almost since day one. She's very skilled. And behind them, kind of hiding, is Jen Sanford, exceptional wound nurse. And between me and Wendy is Amy. She's our medical assistant. Very hard worker.
Now how did they become proficient at being a wound nurse? Is that a specialty area?
It is. I'm board certified in wound care myself as a medical provider, and Sue is a WCC, which is wound care certified as a nurse. And when I found her, she had that certification already, so I was super lucky to find her. Jen hasn't been able to get her certification yet. I hope she can soon. And trained with Sue and I, and does a fantastic job. Very caring, careful bandager, because it's all about the bandages where we are and how they're applied.
Okay. Next picture, please.
We have 3 exam rooms.
Okay.
And that is our waiting room, which I understand that the hospital's going to help us to fix that up a little bit. They've gotten us a television. And
I'm going to bet, I'll bet it's the auxiliary.
I think it is the auxiliary. I want to tell you how grateful we are. It's difficult. Sometimes there's nowhere for people to sit. So we're going to get some new chairs and a television.
They are so supportive of the hospital and maybe even the foundation. And then we got a picture of the examining room, I think, Jeff?
One of the exam rooms, yeah.
Let me pop that up here. There we go. Wow.
Oh, no, that's the waiting room, and that's looking at the receptionist, Wendy.
Okay. I think we only had 3 pictures.
Oh, maybe
Jeff, do we have any more
I hope I didn't neglect. Maybe I did neglect to send you the exam room. I'm sorry.
Okay, that's okay.
You can see off to the right, exam room number 2. That's the one with the bed in it.
Okay, nice and clean and bright and cheery. Okay, so I have so many questions now. This is.
Maybe we can extend the show.
Yeah. I taught biology. I'm a special ed teacher, but I was teaching some sciences, and so this always gets my attention. So I'm sitting here and I'm thinking, like, with the aging population that we have in Chautauqua County, we're a growing old county. That means the boomers are moving into their 60s and their 70s. And everything, true or false, a lot of things you're telling me about is an aging issue?
Absolutely.
Absolutely.
Aging is a big risk factor.
Okay. So for those that are watching right now, if you do have a question regarding any of these treatments, or if you have something going on with your body, give us a call and we'll try to field some of those questions with LaTroy, okay? Next question I have. I know enough seniors over the years that they get something, a little wound, a little cut, a little bruise, and the thing starts festering, and they don't do anything about it. Do you find that true?
I do, and generally they'll go to their primary care provider and ask for a treatment for it.
Oh, that's if they go to their doctor.
If they go,
A lot of times they, no.
What I usually tell people out in the world, if you're generally healthy, if you get a wound, give it a couple weeks to heal. In 2 weeks, it should be healed or very nearly healed, and if it's not, maybe you need some specialized help.
Okay.
However, if you're a diabetic, I would recommend that you go as soon as you get a wound, if it's on your leg or foot, because those are the ones that can be dangerous for diabetics and can heal much better if you intervene quickly.
Now, why is it dangerous to diabetics?
Diabetics typically, and again as they age, have poor circulation. They have neuropathy, so they have a lack of feeling in their feet.
So the nerves are dying.
Correct.
Okay, and that's what you see people kind of shuffling, or they have trouble with balance because they can't feel.
Sometimes, but quite often there's no sign at all. They can have a wound on their foot and they don't realize it doesn't hurt, so they don't take it seriously. And sometimes when they come in, they've let it go for a long time and it's very
so with the
challenging.
neuropathy, they can't feel that there's a wound there.
Correct.
Okay, all right.
And it doesn't hurt. You and I wouldn't be able to walk on a wound like that because we have normal feeling in our
We
feet,
feel it, yeah.
and they walk on wounds that sometimes are horrific, sometimes even down to the bone. So diabetics, I recommend you come in immediately. And of course, call your family physician for a referral.
Okay.
We do accept people that have not had referrals from their primary care providers. You don't have to, but I do recommend that your family physician be aware of that.
Right. Well, yeah, because you want that whole case management so everybody knows what's going on.
Exactly.
All right. So I know we're jumping around a bit, but so if someone's listening right now and they do have an issue, they might say, well, my insurance isn't very good. Is that an issue?
Oh, that's never an issue, ever. We accept people at the wound clinic regardless of the type of insurance, regardless of their ability to pay, and we're happy to do so. As a matter of fact, I have no idea what most of my patients' insurance are. I have no interest in knowing.
Okay. You're there to
I'm
serve.
there to help the people, exactly.
Awesome.
As a matter of fact, we even accept donations. When people have healed, sometimes they donate back dressings that they have left over rather than throw them away, and we can sometimes even help patients by giving them some bandages.
Interesting. Okay. I'm gonna tell you a little story, and I think it's going to pertain to people that are watching right now. My dad lived to 94, great age, but he had congestive heart failure. And you know, as you grow older, you start to listen to things that become more pertinent to you and the people around you. But in my 20s, I didn't even know what congestive heart failure was. So then I realized what congestive heart failure was because my dad began to fill up with fluids. And he had to take, medicine to keep the fluid off. But over time, I was also learning that his legs were swelling up. And you're already understanding where I'm going. And I would say to him, your legs don't look real good, Dad. I think you need to talk to the doctor or the nurse or whomever. And they would say, here's some salve or whatever. And I'm not saying that it was to the point that it was horrible or anything like that, but I found that, and I say this all the time to my viewers, we got some rockheads out there that are in this boat, that they're sitting right now watching my show or listening on the radio, and they're saying it'll be all right, and they keep putting on gauze bandages, and it's getting worse, and it's getting festering and oozy and all that stuff. It sounds to me like they should have come see you a long time ago.
They should. And I hope they're not afraid to, because I know everyone's different and everyone's nervous about what we do at the wound clinic. But we try to provide service and bandages that work for the patient's lifestyle. Not everyone can use a particular type of bandage or be happy with it. If they're uncomfortable, we have probably 150 different bandages that we can use to make it so that they can take a shower if they want to, so that they can walk around normally. We have some that are beige, so they're not really conspicuous. So we have a lot of things we can do to make people more comfortable while they're caring properly for their wound.
Now, you mentioned 150 different kind of bandages. Do you use ointments and medicines as well?
Absolutely.
Let's talk about that a little bit.
Well, sometimes a wound will require a prescription ointment, and you get that at maybe a pharmacy. Quite often, we'll use bandages that are solid. Some of them are organic. Oftentimes we'll use a calcium alginate, for example. That's a woven bandage that you can cut to fit your wound. It can be impregnated with antibiotic or not. It's made from brown seaweed. Sometimes we use collagens, which are little pads that are made from porcine or equine collagen and provide a scaffold for wound healing. It helps the cells to grow, reduces inflammation in an older
Wait a minute, you
chronic
just talked
wound.
about a horse in there somewhere.
I did. Or in a pig. They're very, you'd probably know this, cellularly they're very similar to human beings, and they've made bandages out of some of their cells that help human beings to heal.
That's what I love about this show. Every Saturday I learn something. I've never heard of this before. I've heard of valves and various other parts, but never bandages made out of this.
Absolutely. To promote faster wound healing.
Faster wound.
And sometimes ointments. We have actually platelet-derived growth factor, which is a growth factor from a human body that we can prescribe. Most insurances cover it for diabetics,
Is
for
that
example.
a
It's about
topical?
$1,000 a tube. It's a topical.
$1,000
That's why
a
I mentioned
tube?
most insurances will cover it for diabetic ulcers.
Wow. Okay. So if someone is a rockhead, like some of my viewers are, and they let it go, and now we've got a major outbreak, and maybe infection and things like that. So can you help them?
Absolutely.
So it's never too late.
It's never too late. Wound clinics reduce the amputation rate in areas that they open in. I'm really proud to say that we've been able to do that. Somebody like your father, for example, maybe he needs an antibiotic. If there's an infection there, I worry because sometimes people get antibiotics for wounds when that's really not the issue. They need good wound care. They need the correct bandage and sometimes compression. So somebody like your dad who has congestive heart failure may have swelling in their lower legs, and we see that a lot.
Oh, yeah.
Well, we have a lot of bandages we can use that we can wrap the legs with to push the swelling out of the leg. We can prescribe, after they're healed, compression stockings or compression garments, sometimes lymphedema pumps. There are lots
What was
of
that?
different
What
things.
was that last one?
They have pumps that will compress the leg
Really?
and push the fluid out.
Oh, that's like the things you see in the hospital when they're, a lot of times after surgery.
Those
they put
are
those
sequential
things.
compression devices, but it's
Okay.
a similar mechanism of action. And you'd wear them on your leg for 45 minutes or an hour a day, and maybe sit down and watch your favorite television program. And that's after you healed, because it's not just about healing the wounds, it's about giving the patient a plan that will keep them healed so they don't come back. So
Okay.
that's something they can use long term to keep the swelling down, prevent the sores from coming back.
I'm going to speak on behalf of all those right now watching again that wear compression socks. I hate them. So I remember various people, not just my dad, but they struggle to get those stockings on. Do you have something better?
Absolutely.
You do?
They actually make donning devices that help you get your stockings on. They make zippered stockings, and they make some devices now that Velcro, which are really dynamite.
Oh, that would be cool.
Yeah, there are different kinds. A couple weeks ago, I went to Charlotte to the world's biggest wound conference. I try to stay very up to date to offer my patients the newest innovations in wound care. And I
I'm
just
impressed.
ordered a sample of a new one. I'm very excited to see that's one of the Velcro devices that looks very easy to use. So,
Dad would get those socks, and he would just, he never swore, but you knew that he was saying something inside him because he just struggled. 94 years old, his legs are swollen, and he ordered these socks through a medical supply outfit, prescription, and they say, well, all you got to do is just do this, and he just absolutely hated it.
a lot of people don't have the strength in their hand or the manual
No.
dexterity to pull the stockings on.
Or bend
That's
over to
why-
do it or whatever.
Exactly. Some people can't bend over that far. So there are other devices that are available that we can prescribe. So we like to communicate well with our patients and say, is this working for you? Are you able to put this on? Are you able to get it off? If not, we've got other things we can try.
Now, I remember Michael Jackson sleeping in some bariatric or something called, whatever you, did I say it right? Bariatric?
Hyperbaric.
Hyperbaric.
I actually am board certified in hyperbaric medicine.
You are?
And I did some hyperbaric down at St. Vincent years ago when I worked for the physician I mentioned previously. It's a wonderful treatment, and it does a lot of good for a lot of reasons.
Do you have that?
I don't have it. They have it at the Allegheny Health Network, St. Vincent Hospital in Erie. And the physicians down there and we collaborate a lot. So if I have someone that needs that, I can send them down there.
Okay.
There are also some centers in Erie or in Buffalo that I can refer to if it's more convenient for the patient.
So let's talk about that just a bit. So do you send
Hyperbaric
many people?
oxygen is a tricky thing because it is only approved for 13 diagnoses. And that's a Medicare decision. And the most common one that we would see that would qualify for that would be a diabetic ulcer.
Okay.
It has to, however, be a certain depth and severity to qualify.
I was fine until you said depth. Oh,
Well, the
I hope you're
hyperbaric,
talking about millimeters.
sometimes centimeters,
Okay,
unfortunately.
Oh my gosh. So really, pretty severe.
It has to be quite severe.
Okay.
Yeah.
Ouch.
And it's so expensive that we have to make sure we meet all the criteria so insurance can cover it.
Yeah. Okay. So let's say they're eligible. So what do they do? I mentioned that Michael Jackson's sleeping in one of these things, but I mean, what does it
Well, if
actually
you need hyperbaric oxygen treatments, we'll refer you to a hyperbaric center like the one at Allegheny Health Network in
Okay.
St. Vincent, and the providers there will give you a physical and evaluate to see if you're a good candidate for it. Typically, if that happens, you have a diabetic wound with an osteomyelitis, which is an infection in the bone of the foot, meaning the wound has gone down to the bone.
Holy mackerel.
They're quite severe infections, and the patient, of course, at that point would be at risk of amputation. So the hyperbaric chamber helps in a number of ways. It actually kind of melts oxygen into your cells so it can get some oxygen to areas that aren't well perfused with your vascular supply that you have, reduces inflammation, reduces swelling, kills some bacteria that cause infection. So it does a lot of things to help promote wound healing, including angiogenesis. So it creates new blood vessels.
Who?
Angiogenesis?
What is that?
It helps to create new blood vessels
Okay.
to perfuse or
See, my job
provide
is to
blood.
ask questions when you say something that nobody on the other side of that screen knows what angiogenesis.
It creates new blood vessels down to the wounded area to help with the blood supply. So if you need hyperbaric oxygen treatments, you would go into the wound clinic, into the hyperbaric area. You get on a stretcher that slides right into the chamber itself. Now, St. Vincent has a monoplace chamber, which is one person per chamber, so you have your privacy. They slide you in there, shut the door, and they pressurize the chamber and fill it with 100% oxygen.
Whoa.
So you're not only breathing oxygen, but it's, again, being kind of melted into your
Now,
body
do you sleep
with the
during
pressure.
the time?
You can sleep. You can do whatever you want. You're in there for an hour and a half to 2 hours at a time.
Oh my God. And if you're
You might be-
claustrophobic, what do you do?
If you have claustrophobia, it can be challenging. So we sometimes will have someone obtain a prescription for an anti-anxiety medication from their family physician.
I'm just thinking of a few people right now that are claustrophobic and they don't know.
I think that what helps as well is those chambers are glass. There's completely clear. You can see out. You can see the nurse sitting next to you. There's a telephone that you can talk to the nurse on.
Oh, that's cool.
Yeah, and there's a television above each chamber so you can watch your own programming to distract you from the treatment. So the chamber is then pressurized to 2 or 3 atmospheres, and you lay there and receive your treatment.
I got to tell you, this is one of the most fascinating interviews I've done in months. This is so cool. I could do this all day. Okay, so infection you've mentioned, and obviously that's the core of the problem is some type of infection, other than something that pierces your body and makes an opening. My biggest concern over the years, whether it was my children or my father or myself, is how do you know when you have an infection? Now, that might seem like a stupid question.
You know what? It's not a stupid question because I've even seen seasoned practitioners, physicians, nurse practitioners, physician assistants that have made a mistake with infection, and it can be tricky. I've made a mistake with infection. Some of the diseases that I treat have symptoms that can mimic infection with redness, swelling,
There you
and
go.
warmth.
There you go.
So it's tricky. If I look at a patient and they've already taken an antibiotic and the wound or the swelling or the redness has not improved, then you want to think, is there something else going on? Maybe there is venous stasis. Maybe there's lipedema. Maybe there is lipodermatosclerosis. I'm throwing all these strange words at you, but
Yes,
they
you are.
all can be diseases that cause redness, swelling, and warmth. Venous stasis is a one that I see very often.
And then you said that's associated with diabetics?
No, venous stasis is a disease all by itself, not associated with diabetes necessarily, that the veins are bad. The veins put the blood back up to the heart, and the blood goes down. Maybe they have a good flow down to the foot and leg, but it doesn't go back up because the valves system that promotes the blood going back up to the heart is diseased. So the blood kind of pools down there, leaks out of the blood vessels, makes swelling in the lower leg. That can turn red because in the blood vessels, of course, are red blood cells which carry heme, so the hemosiderin will leak out and stain the tissue. When that first happens, it's bright red, and it can be mistaken, like I said, even by seasoned physicians, as a cellulitis, when in fact it's an acute venous stasis problem. So if it's treated by an antibiotic, they come into me, and I've seen it hundreds of thousands of times, then I can make a determination, maybe this is something else, and they'll respond better to a compression bandage, elevation, lymphedema pumps.
Now, some of these wounds are, and I don't want to put it quite like this, but are some of these going to be lifestyle issues for the rest of their lives? With diabetes and the congestive heart?
Absolutely, absolutely. With the swelling in the lower legs and the venous stasis, which I mentioned is the thing we see the most of, I always recommend, and this is a good advice for anyone across the board, elevate your legs when you're seated, exercise. They've done research that has showed that exercise helps wounds to heal across the board, regardless of the cause of the wound. We recommend a high-protein diet to promote wound healing as well.
Okay.
And those things are great for everybody. Specifically for diabetics, prevention is key. We always check circulation to make sure there's not an arterial or blood flow problem.
So that's when you're listening with a stethoscope to listen to like different parts of your body?
Not usually.
Just feel it?
Well, I'll do a clinical exam, so I'll look and see the color, the temperature,
Okay.
where the wound is located and what the wound looks like, how much
Okay.
drainage it has. So there are a lot of signs that can tell me whether a wound is a vascular wound or not. Sometimes we'll have them go see a vascular surgeon or do some testing like ultrasounds and things like that to determine that they have adequate blood flow. If they do, then the problem is probably the neuropathy. They've got pressure. When you have diabetes and neuropathy, your bones and your physiology of the foot change. Your bones in the forefoot can drop down.
Really?
You can sometimes have a collapse of the bones in the midfoot that causes a deformity called a Charcot. When those things start to happen from the neuropathy, you need a special shoe. So we'll refer someone to a prosthetic orthotist that can make a custom molded insole for and get them a diabetic shoe. Sometimes that's all it takes to protect the foot and create a situation where the wound can heal and prevent recurrence of the wound.
This is fabulous. We've got a phone call. We want to take a call?
Sure.
Good morning, caller.
Well, good morning. This is Linda Spalding.
Good
How are
morning,
you on
Linda.
this gorgeous day?
I'm great, but this is a fascinating show. I don't know if you've been watching or not.
Yes, it is very interesting. I didn't know that a special shoe would really help people with neuropathy.
Absolutely. Sometimes it's the biggest thing that I can do for a diabetic to heal or prevent wounds.
Amazing. I've never heard any of this stuff. So, Lynn, what are you up to? Do you have a question or a comment?
Oh, well, I just wanted to say good morning and welcome
morning.
your guest. Also, we don't have many days left in May, but May is remembering the value of the mature person, Older Americans Month. And our plant sale is finished. It was a big success. I don't know if you got any plants.
No, but that's just because of my schedule.
I've got some really beautiful ones. They're really
Great.
great selection. And thank you for publicizing it for us.
You're very welcome. Linda, since we're talking with LaTroy about health issues and wounds and things like that, since you work with the Office for the Aging, is this something that you're seeing?
I don't see too much of that myself because I'm in the employment unit.
Right, but I mean, some of your employees, I mean, they have issues with infections and diabetes and so forth.
Oh, yeah. Diabetes is very common. I don't know if you realize that. I'm really surprised. I mean, growing up, I just wasn't aware of so many people that had diabetes. Well, I had, my stepfather had it from childhood.
Wow.
And he was taking insulin from his childhood days. And I had a diabetic dog, a poodle. Yeah. We had to test him twice a day.
Jeepers.
And he got insulin shots twice a day.
Goodness. All right. So anybody anywhere could have one of these issues then. Okay.
Yeah, but do you find that there are more people with diabetes today?
Actually, that number has been increasing steadily and is expected to continue to increase.
And I think I'm hearing more and more because of our American diet.
And lifestyle.
And
Is
lifestyle.
it because of the diet?
Diet and lifestyle, not getting exercise, all that good stuff.
Yeah. I know when I taught school, I had a boy that had diabetes. He was quite young.
Okay. So anything else going on?
Not only that it's a beautiful day, and I plan on doing a lot today. I don't know about you.
Oh, yeah, I got my honey-do list. Okay. Well, thanks always for calling in.
Oh, and thank you. And have a wonderful weekend and week.
Okay, you too, and happy Memorial Day.
Happy Memorial Day to you, too.
Okay.
Bye-bye.
Bye-bye. Okay, so we were talking about infection, and so people at home, I keep going home because people are reluctant to go to the doctor. They're reluctant to go to the ER. So how about just give them a primer here of what they should look for and when they should talk to their doctor. How's that? Is that fair enough? Mm-hmm. Okay.
Generally speaking, if you're a diabetic and you have an area on your foot that feels funny or looks funny, you should have it checked immediately. A diabetic will start out with a problem and not realize it's a problem because it will start as a callus. A diabetic with a callus on the bottom of their foot, we refer to as a pre-ulcerative callus. That means that that area has too much pressure on it.
Okay.
And it's going to break down if it's not well cared for or pressure relieved.
We keep talking about feet. Mm-hmm. Do diabetics develop ulcerated areas other places?
They can, absolutely. There's actually a diabetic dermatitis that I see a lot of called necrobiosis diabetica lipoidica, and that can cause a rash on the legs and ulcerations that are really challenging to heal unless they're identified and treated properly.
Mm-hmm. Okay, so the callus looks just like a callus. I mean,
just like a callus. But if you're a diabetic, you have to take it more seriously.
Now, is it on the heel or any part of the foot?
It can be. Usually it's on the bottom of the foot, so it can be on the bottom of your toe, the bottom of your forefoot, or it can be on the bottom of your heel. I have diabetics right now at the Westfield office with an ulcer on each toe, on each part of the foot.
Now, in the old days, untreated, you would actually amputate toes and
absolutely
body parts.
And occasionally that does still happen.
Oh boy.
Unfortunately.
Okay, so other kinds of infections. Let's go to the folks with congestive heart failure where their legs begin to swell and the skin breaks down. What should they look for there, and when should they come in?
Well, the ulcers of congestive heart failure are very similar to the ones that I told you I see the most of, the venous stasis ulcers. And quite often those two diseases do go hand in hand. When you have swelling in your lower legs, if you start treating it right then and there, you can prevent the ulcerations from coming, because that's a complication that occurs later on.
Right.
So you can go into your family physician and get some compression stockings. You can do the elevation that I mentioned. If that doesn't control it, or things get worse and you have blisters, leaking, or ulcers, I'd come right into the wound clinic. We do compression bandages that kind of squeeze the fluid back out, and we can put bandages on that will heal your wound much faster, and then put a treatment plan in place to keep the swelling down and prevent recurrence of the problem.
I'm sitting here and I'm shaking my head because I'm thinking, somehow I feel remiss that if I had known this, I would have pushed my dad to go to a wound clinic. But we had no idea, and because he was at the point where I think he would have improved his lifestyle had he got to see you folks. But he was up in Buffalo, and that's another story. LaTroy Navaroli is my guest today, folks, and we're down to 1 minute and 20-some seconds. So, LaTroy, I'm going to let you just talk to the folks and tell them anything you want about what you do for them and services and how they get a hold of you. How's that? So, let's go for it.
Well, we're at the wound clinic on Mondays and Thursdays all day. We open at 8 o'clock, and we're usually done around 5. We never turn a patient away for any reason. We take referrals from the community, or you can call the office at 716-793-2210 on Monday or Thursday, or call the appointment line during the week to make an appointment with us.
Right, and right at the front desk at the hospital, they can always refer and so forth.
Yeah.
Okay. All right, well, folks, this has been, to me, a very enlightening show, and I hope that as you review this or go back to YouTube and look at it again, that you'll glean something out of this and it'll be benefiting somebody like yourself or a member of your family. And don't wait. I would say that would be the mantra for today, right? All right. LaTroy, thanks for joining us today, and I'm fascinated by this. We're going to talk some more after the show here, I think.
Okay.
So we're right down to the last few seconds here. So I want to wish everyone a restful Memorial Day. Remember those that have fallen in service to our country, and pay good respect to those folks. And do be safe. Get out there. Use a sunscreen. And if you do have an issue, we'll see LaTroy over at the wound clinic at the Westfield Memorial Hospital. I'm Doc Hamels. I'm signing off. We'll do it all again next Saturday right here on Access Chautauqua 1301. Take care now. They even